ZAMBAT, Zambia AIDS Related TB Project, is a Zambian NGO formed in 2004 from a collaboration between the School of Medicine, University of Zambia, and the London School of Hygiene and Tropical Medicine that started in 1989.
So ZAMBART stands for the Zambia AIDS Related Tuberculosis Project, and we're a research group who conduct research into tuberculosis and HIV, so TB and HIV, and the way that the two of them work together. It's an organisation, it's been in Zambia for over 20 years, conducting research and also increasing the research capacity of Zambians to do research in this field.
Based in the School of Medicine Ridgeway campus of the University of Zambia in Lusaka, ZAMBART Project now collaborates closely with government, non-governmental and academic institutions within Zambia, Africa and the rest of the world. ZAMBART staff form an interdisciplinary team with a range of expertise including epidemiology, clinical science, social science, laboratory, operations research, health systems research, health policy analysis, health economics, and counselling. ZAMBART focuses on the overlap between TB and HIV in order to improve the quality of life of people affected by the dual epidemics.
And the focus of ZAMBART has especially been researching ways to limit the spread of TB and HIV at the community level, putting in unique interventions that, are cost-effective and easy to replicate. I think that's one of the key aspects of the project itself. They're looking for practical ways to really get a grip on these dual epidemics.
TB is a major problem, particularly in this part of the world. TB is not a new disease, it's been around for centuries. But in the Western rich world, TB has been going down. Whereas here in Africa and also in other parts of the world, it's on the increase. And the reason it's on the increase is because of the HIV epidemic. HIV weakens the body's immune system and so allows the TB to come through and cause disease. And so the two together are this deadly duo that just cause this inflated epidemic of the two diseases. So in this part of the world, it's impossible to look at TB without considering HIV. And I think it's also impossible to look at HIV without considering TB.
Internationally, ZAMBAT is recognized as one of the foremost TB/HIV research groups in the world, and its researchers sit on the WHO TB/HIV Working Group and have assisted in the writing of WHO technical guidelines and policy documents.
We know that often people come very late for TB treatment. So what are the so people would say, well, how can we change that? And so that's a question. Could we do some intervention that would encourage people to come for treatment earlier? And so then we design a study to try and answer that question. What intervention would work? How would it work? What difference would it make to tuberculosis? We then seek funding for that study and we conduct the study and present the results both nationally to Ministry of Health so that they can see whether they need to change anything they're doing, but also internationally so that international policy can also be changed. And ZAMBART's actually been very successful. It's led the field in TB/HIV research internationally for all the time that it's been active. And there are international policies and guidelines on how to manage TB and HIV together that have been developed by the WHO and that are now adopted in most of the countries of the world. And a lot of those policies are based on work that was started here in Zambia or include work that was done here in Zambia by ZAMBART with the Ministry of Health. And so I think ZAMBART has been very influential in this field of TB and HIV.
In addition, ZAMBART is actively involved in regional and international research consortia through DFID-funded projects such as Targets and Evidence for Action, as well as the ZAMSTA study funded through the CREATE Consortium and Bill and Melinda Gates Foundation.
The ZAMSTA study fits into the ZAMBART project in the sense that ZAMSTA is one of the studies within ZAMBART. ZAMBART is the mother body, it is the main project, but currently ZAMSTA is the main study being conducted in ZAMSTA, employing about 200 employees at the moment. Yes. And also it fits very well in the ZAMBART study in the sense that we share resources. By this I mean finance as well as human resource with other studies. This makes it possible to really implement the interventions cost effectively, but also it makes it possible to implement other studies using the ZAMSTA resources.
ZAMBART's research approach is unique in that it looks holistically at the dual epidemics of TB and HIV, as well as their impacts on health systems and external factors for patients' livelihoods and family.
The most important thing that is cardinal is our strong collaboration with the government. You may wish to note that we actually work within the public health facilities. So we are not only doing research, but we are also contributing towards the strengthening of the health system by virtue of us working within the public health facilities. We've not only looked at the clinical dimension of providing health services, but we've also taken into account the social dynamics, the social behavioral aspects that influence, for instance, health-seeking behavior. What makes people utilize certain services and what makes people not utilize certain health services.
I think the research approach is unique because we've been here for so long. We started right at the beginning and we're not going anywhere, we're staying put. And I think it's that long-term commitment to solving a problem in situ, not with people flying in and out of the country, but doing it in Zambia with Zambians, for Zambians, that's really very unique. We work very closely with the Ministry of Health, who are fantastic partners, and very closely with the University of Zambia as well.
The organization is also committed to building local capacity of Zambian scientists and researchers. ZAMBART's relationship with both the Unza School of Medicine and the London School of Hygiene and Tropical Medicine have allowed for hundreds of Zambian students as well as its staff to access higher learning degrees, various training seminars, and exposure to cutting-edge technology over the past 20 years.
ZAMBART is, as an NGO, can be said to be one of the unique NGOs insofar as capacity building is concerned. In as much as we are doing research, but the other aspect of it is the capacity building of Zambian scientists. And this has been done in two main ways. First is some researchers are actually doing their postgraduate training. Others have been sponsored for specialized courses. The second aspect of capacity building has come in the form of mentoring. And through working with researchers from outside the country, for instance from the London School of Hygiene and Tropical Medicine.
The impact of the interventions at the community level has involved a concerted effort from a variety of different stakeholders.
The impacts of the interventions on the community or in the community are right now at two levels. First level is the immediate, and the long term we are yet to get those because we are right now doing prevalence survey to measure in full to what extent these interventions have impacted in the community. But on the first level, we have the results already. And these results can be categorized as follows. Number one, we have created awareness in these communities for people to know, have more information and knowledge about TB and HIV. Secondly, we have made sure that issues of stigma in the community are reduced or worked on. And not only that, we have actually created a partnership between the health center and the community. In the past, a person who had TB drugs to take, they wanted to hide. They didn't want anyone to know. Now they can freely go and take these drugs in their houses, in the community, because people now know. They are very free. Issues of HIV, people on ART treatment are also openly taking these drugs. They are discussing freely. They come for reviews freely. And so that is simply a remarkable impact that we can say as a result of these interventions, plus many other activities that are going on, communities have actually come on the fold. Things are working.
We as a community, some of us being a community person, we like this project very much. And we have encouraged the ZAMBART people to continue, because what we want TB to be reduced.
There is remarkable progress involving communities and individuals in the work being carried out by ZAMBART in improving the quality of life of people affected by TB and HIV. There is still a long way to go in the fight to stop TB. However, the ZAMSTA interventions in place in Zambia have the potential to impact the way people approach TB and HIV together the world over.